Hi, Dr. Kevin Windish here from Sparks Pediatric and Adolescent Medicine. Haven't been around a lot in a long time because I've been really busy doing a whole bunch of things. But this measles epidemic has finally reached a point where I feel like I need to make sure everybody's thoroughly and correctly educated. There's a lot of misinformation being passed around out here. Unfortunately, some of it through very official channels like Health and Human Services. So, to be clear, there is no treatment for measles. Most viruses don't have a treatment. If they do, those treatments are very, very specific. COVID is treated only by Paxlovid, and Paxlovid really only treats COVID. Um, Herpes virus and the virus that causes shingles, herpes zoster virus, can be treated with acyclovir and some of its close cousins, valcyclovir, for example. But acyclovir and valcyclovir treat only those two viruses. They don't treat influenza. They don't treat the common cold. They don't treat herpes. Ganciclovir will treat CMV, cytomegalovirus, but ganciclovir does not treat West Nile virus, for example. There is no treatment for measles. No miraculous treatment, no secret treatment, no treatment being done in West Texas that only a handful of people know about. There is no treatment for measles. If you get it, it will run its course. We do things to try to prevent secondary problems from measles. We might use inhaled or intravenous steroids to bring down swelling in the brain or in the lung. That's something called budesonide. We might use antibiotics if you get a secondary pneumonia, a bacterial pneumonia on top of the measles virus. Or if you become so obtunded or unconscious that you accidentally aspirate food or saliva and get a pneumonia from that aspiration, inhaling that material. We'll use antibiotics for the secondary pneumonia, but the antibiotics do not treat the primary problem, measles. We do, however, have an effective prevention, a very effective prevention. That is the measles, mumps, rubella vaccine. That vaccine has been around now for over 50 years. Literally millions of doses have been given. Unless you are immune ablated, actively receiving chemotherapy, and I don't mean taking prednisone for your asthma. I mean receiving chemotherapy from your cancer doctor. Receiving certain biologic agents from your rheumatologist or gastroenterologist or dermatologist. Or have severe combined immune deficiency syndrome, SCID. Adenosine deaminase deficiency, something like that. Then you qualify to be vaccinated with MMR, having rheumatoid arthritis, having multiple sclerosis, having Crohn's disease, but not being on biologic agents does not disqualify you. Certain biologic agents to prevent the course of the disease might disqualify you from being vaccinated. And if you're going to go on those medications and you're not already vaccinated, you should be vaccinated first, then start those medications. The vaccine has never been shown to cause autism. There was one study. That study was paid for by Andrew Wakefield. Andrew Wakefield, it turns out, was paid by an attorney's group to drum up evidence so that they could sue the manufacturer of MMR. But there was never any evidence that it caused measles Andrew Wakefield's original study was so flawed, I didn't take it seriously when it was first published. There was no control group. And he leapt to conclusions that frankly made absolutely no sense. And I still don't completely understand how he got there. Well, I do now. He was paid to reach those conclusions, and so he reached them. That anybody ever took them seriously still boggles my mind. MMR vaccine does not cause death unless you're immune ablated, and then it's still generally safe. MMR vaccine does not cause intellectual disability, previously known by the now non-PC term mental retardation. It does not cause multiple sclerosis. It does not cause diabetes. It does not cause early death. It does not cause cancer. It does not cause hepatitis. It does not cause pancreatitis. Measles virus is the most contagious virus that we know of. It kills roughly 1% of the people who get the disease in the acute phase. And in the non-acute phase, we don't really know how many people it kills, but it causes a horrific side effect called subacute sclerosing panencephalitis. Feel free to look that one up. You can do a YouTube search for videos of patients with SSPE, or subacute sclerosing panencephalitis, and see what their lives are like. It's something out of a Stephen King novel, or worse. M. Night Shyamalan movie, maybe, if you like horror films. The Secretary of Health and Human Services is correct. It is a free country. It is your choice. It's your choice to protect your child or not. You can be vaccinated as young as 12 months of age. In areas of epidemic, you can be vaccinated as young as 6 months of age. However, if you are vaccinated under 12 months of age, you need a third dose. Normally, it's one dose given at 12 months of age and another dose given at least a month later. That second dose typically is given around 4 years of age, but can be given as little as 13 months of age, provided the first dose was given at 12 months of age. But if you got the first dose under 12 months of age because you live in a epidemic area, then you need a third dose. Should you get a third dose? Should we start vaccinating 6, 8, 9-month-olds? Well, the CDC and the Advisory Council for Immunization Practices are not recommending that at this time. But it's unclear to me whether that is because that's truly best practice or if that's because the Secretary of Health and Human Services has ordered that they not recommend that, in spite of the fact that maybe they should. So that's something definitely to discuss with your provider. My children are all older now, my youngest being in middle school. But in the last epidemic, my youngest was 3, I think. Maybe she was 2. And we made the decision that, who do sick people come to see? They come to see the pediatrician. And so conceivably that could have been me. And we didn't want to take a chance of bringing that home with us. I'm vaccinated. My wife is vaccinated. And we both have proof of immunity. But we didn't want to take a chance that somehow my child being around where I practice and work got exposed and got measles. So we gave her second dose at roughly 2.5, 3 years of age when the last epidemic rolled around, because the way the vaccine works, that second dose is not a booster. The vaccine, booster shots like your tetanus shot work like this. Each time you give the shot, you get a little more immunity until eventually you have really strong and permanent immunity. Measles virus is a live virus vaccine, and as a result, one dose provides 100% lifelong immunity. Unfortunately, it only does that for roughly 90 to 92% of patients. However, the second dose, given to everybody, will take that remaining 8 to 10% of people and provide 90% immunity to them as well. 90 to 96% immunity to them as well. Resulting in roughly 95 to 98% efficacy. Lifelong with 2 doses. But for the people that responded to the first dose, it was 100% immunity with the first dose. Why don't we check titers? Because frankly, it hurts a lot less and it's a lot cheaper to give a second MMR than to get your titers checked. Drawing blood from a 1-year-old, it's got to be venous blood. It's not the most pleasant experience. The kids hate it, the parents hate it, the phlebotomists hate it, and it's ridiculously expensive, considering that there are no serious side effects from MMR. And frankly, it's better tolerated vaccine than something like tetanus, which causes a lot of fevers. We generally just give the second dose. Could you opt to get titers checked at 13 months of age and opt out of the second dose? Well, if you're titer positive, yeah, you could. Did you do your child a favor? I personally don't think so. You definitely didn't do your wallet a favor, but that's a personal choice. The Secretary of Health and Human Services is correct. It's a free country. Make a free choice. But there's only one way to prevent measles, and there is no treatment. Make sure your choice is informed.